Well, good afternoon. Today, we release the next phase of our expanding testing strategy. We're working around the clock to get more people tested across the province. We're going into all sorts of hotspots. We're encouraging people to get tested. And we're also proactively looking for cases. We've started proactive testing of hospital staff, long-term care residents and staff, correctional workers and inmates, and essential workers. We're also proactively testing vulnerable populations and the staff who care for them in group homes, shelters, emergency child care centers, and other congregate settings. We're getting mobile testing teams up and running. These mobile testing teams will be rapidly deployed to hotspots across Ontario to help deal with any outbreaks. And I'll repeat it again, if you have COVID-19 symptoms, if you're worried, you've been in contact with someone with COVID-19, if you or your family are worried about exposure, in short, if you feel you need a test, please go get a test. You will not be turned away. We have 129 assessment centers open to everyone across the province, ready to serve the people. And I've been pleased to see the testing numbers going up this week. Yesterday, we completed 18,500 tests. This is progress, and the team knows I expect them to keep the numbers up. And I want to be clear, ramping up testing means that we'll find more cases, and that's okay, because finding more cases means we can contain the spread faster. We can't manage what we can't measure. The more people we test, the more contacts we can trace. We have an army of 2,000 contact tracers in the field right now following up on cases. And we need to keep increasing that capacity. More testing will also help us better understand the trends. We want to know how the virus is spreading. We want to know how many people each new case is infecting. Today's expanding testing strategy is a critical step. Getting those testing numbers up is absolutely essential. The more data we have, the better we understand what is happening on the ground. And having that information is what will help us determine the best path forward, because the reality on the ground is different in every part of the province. And we are now getting much better picture of what each region is dealing with. With more testing, that picture becomes more and more clear. And knowing that information will help us be more precise. It will help us be more targeted. It will help us understand where the resources, where the public health measures are needed most. And that's why now that our testing is getting to where we need it. And I am now comfortable with asking our officials to look at a regional approach for a staged reopening. This will be one option we consider as we move into stage 2. This is one option that we're putting on the table. And we're only able to do this now because we're getting our testing to where we need it. So the health officials are looking right now at what regional model could look like. And that work is underway as we speak. I know other jurisdictions have used this regional approach. I want to look at how this has gone in other areas, what lessons we can learn. And it's our job to use the best information we have, to use the advice of the command table, to chart the best path forward. But let me be very clear. I'm not prepared to take unnecessary risks when it comes to our health and safety. We will continue to take a measured, gradual approach to reopening based on the advice of our command table. My friends, we are making progress. We're taking the steps necessary, and we will get through this. We will rebuild what we've lost. We will bring Ontario back with vengeance. We will be the economic engine that gets Canada moving again, and we will do it together. Thank you, and God bless the people of Ontario. I'll pass it over to Minister Elliott.
Thank you, Premier, and good afternoon. Together, we are making real and significant progress in our shared battle against COVID-19. Because of the considerable efforts of every Ontarian, we have entered the post-peak phase of our fight. Workplaces are gradually opening. Health services are slowly and safely resuming. Each of us, parents, workers, small business owners, are adapting to our new normal. As we do, our next phase in COVID-19 testing will ensure we continue to protect the health and well-being of all Ontarians. We are now focusing on 3 branches of testing. The first is assessment centre testing. We have expanded who can be tested to now include individuals with no symptoms, but who are concerned about exposure, as well as continuing routine testing of those showing symptoms. This will remain the foundation and primary focus of Ontario's testing, as it has from the very outset of the COVID-19 pandemic. Today, our strategy builds on this foundation with 2 new branches of testing. The second area of testing will detect and contain cases by expanding surveillance for vulnerable populations who are not showing symptoms, including in our long-term care homes, retirement homes, and other shared living spaces like shelters and group homes. We're also targeting testing of workplaces in priority sectors. Third, we will reserve testing capacity to ensure that we can quickly respond to COVID-19 outbreaks, including in specific neighbourhoods, regions, or at hospitals and workplaces. This will include the rapid and agile deployment of mobile testing. Combined, the significant expansion of testing will provide valuable information about the spread of the virus in different communities across the province. We will continue to learn from this data and adjust or adapt as needed to ensure we continue to protect all Ontarians. As always, nothing is more important. Thank you.
We'll go to the phone line for questions. Just a reminder, 1 question, 1 follow-up. First question.
First question comes from Mark Douglas from 680 News. Please go ahead.
Hi, Mark.
Hi, Premier. If I understand you right, with the staged regional reopening, is this going to mean, in so many words, that different regions will be opening on a different schedule? And if that is the case, would Toronto be the last one to possibly open, or less dense population areas, would they open first?
Well, again, I always say everything's on the table. I think that's one of my favorite sayings because it's so fluid. As you see, things can change rapidly. But before I start off, I just want to thank Dr. Heyer, Dr. Allen, Dr. Williams, Matt Anderson, CEO of Ontario Health. We have an incredibly bright team of medical professionals that give us advice, and that's a fraction of our team, and I'm always going to listen to the medical advice of our command table. It's absolutely critical. But to answer your question, Mark, it's an option that we're looking at. I know other jurisdictions have done this, and again, everything's on the table.
And as a follow-up, just that specific phrase, everything's on the table, this has been an idea that's not been on the table before. If I recall, you've been asked about this idea of different reopening plans for different regions, and you've, if I remember right, you've been resistant to that idea.
Yes.
What's changed now?
Well, again, the more testing that we do, the better idea we have of hotspots throughout the province. We've ramped up testing, and I want to thank, first of all, I want to thank the people of Ontario, because without them, we wouldn't be able to get the numbers up. So I thank everyone for going to get tested and continue to go get tested. I want to thank the health table. These are the folks that I take the advice from. And if they feel, once they have the numbers and a better idea of where the spread is, and once we find out where the spread is, we can contain it with the mobile units. That's the reason. We have a better idea. I've always said you can't manage unless you measure, and the way we measure by increasing the testing. And all the thanks goes to the people of Ontario Public Health, Matt Anderson, and this guy's an absolute champion. I have to tell you, I call him 11, 12 o'clock at night. He answers the phone, and can't say enough about our team. They're incredible.
Next question.
Next question comes from Jeff Gray from the Globe and Mail. Please go ahead.
Hi, Jeff.
Hi, Premier. I wanted to ask about the testing and the targets. It has taken quite a journey to get the province up to the 20,000 now that it can test. Do you see a need to go higher than that? How much higher? How many more tests do you think we need to do? And is it realistic to expect us to be able to do that in the coming weeks?
Well, I'm not going to quantify any numbers per se. They're doing an incredible job. We were up 18,000, and I think a week and a half ago. Then they dipped down, but they're back up. They have a great strategy, and Matt Anderson's heading that up and doing a great job with public health too. I want to thank the public health people. Dr. Williams is doing a great job. He's working extremely hard, and that's the reason we're able to look at different strategies. Again, the more people we get tested, the quicker we can get to stage 2.
And just to follow up with the testing, more testing will mean more contact tracing. You mentioned the 2,000 people. That's a workforce that's going to have to increase, isn't it, to keep up with more tests?
Yes, and we're doing that. We're looking to hire more contact tracers, and I got to give a shout out to Chrystia Freeland, Deputy Prime Minister. She's offered quite a few people too from Stats Canada to help us out, so we're grateful for that, but we're going to ramp up the tracing as well.
Next question.
Next question comes from Lauren Gardner from Politico. Please go ahead.
Hi, Premier.
Hi,
the Prime Minister earlier today said that the federal government is talking to provinces about potentially adjusting the Canada-U.S. border closure to allow family reunifications in some limited circumstances. I'm wondering if you have a position on this and what you might have told the Prime Minister about that.
Well, I always want to keep a tight border and more screening at the border, but what was explained to myself and the other premiers, there are approximately, I hear approximately, about 1,700 families, and reunification of families so important to all of us. You know, and I've heard stories, and we had to help a couple out. I think it was last week that his wife was down in the U.S. He was up here, and they needed help. So it's so important that we reunite families. I think it's absolutely critical. So to answer your question, I support what the Prime Minister's recommending, and it's a relatively small group, I hear, but nothing's more important than family in these situations.
Follow up.
And to follow up, I'm wondering, have you given any thought to whether, and if this is even possible, any kind of regional approach to cracking open the border a little bit more across the expanse of Ontario's border with, Michigan, New York, all these other states where there are a lot of regional ties? Is there some kind of regional approach that could be taken to adjusting these limitations based on what the epidemiology looks like in a certain case, or has that not come up?
Well, we extended closing the border, and that's really a federal jurisdiction, and they're going to be working with the U.S. on it. But when that time comes, because eventually it's going to come, we really have to ramp up screening, meaning no one gets through this border without screening, and if they show symptoms, they get tested, and then they self-isolate and track them down to make sure they're self-isolating. It's absolutely critical we ramp up at the border.
Next question.
Next question comes from Natasha McDonald from Radio Canada. Please go ahead.
Hi, Natasha.
Hi, Premier. Hi. Quebec is recruiting 10,000 healthcare workers to staff the province's long-term care homes. They're going to receive paid training, be paid $26 an hour. As you know, Ontario is still facing a shortage of workers, relying on school board staff. So should the province launch a similar recruitment and training campaign?
Yeah, I've been talking to Premier Legault. I heard his comments yesterday, and we need to ramp that up too, and try to help the frontline healthcare workers that are in these long-term care homes. But if you don't mind, I'm going to hand it over to the Minister Minister of Health on this. Thank you.
Well, I think it has become clear that that's an issue in Ontario as well, and we are working on a health human resources strategy for long-term care homes, but also home and community care. I think this is an issue across the board. We need to have more people stay in the professions, personal support workers. Many people are graduating, but they're not all staying in their professions. So we are examining that. We're working with the Personal Support Workers Association and with other organizations to understand what the specific concerns are so that we can address the concerns and create conditions where people do want to stay and do want to make a career in healthcare. I think with some of them laddering up to a registered practical nurse or having other educational opportunities will be important, but certainly everyone is important in the whole healthcare chain, and we're so grateful for the efforts of so many people on the front line that go to work each and every day. They are the real heroes in all of this.
Follow-up?
My follow-up is for the Premier.
Yes.
Premier, you've been crystal clear about how devastating the Canadian Armed Forces report was.
Yeah.
So I'm wondering, are you considering a formal apology to the residents of those homes mentioned in the report and their families?
Well, my heart breaks, and I apologize every single day. This is, again, this pandemic has brought a lot to light, that a system that's been broken for decades, and we're doing everything, and we did everything we could to make sure that we put the support that is needed. And the 19 homes in red right now, again, we're having the inspectors, we have the hospitals in there, we've taken over the management of seven different long-term care homes. And absolutely, it's heartbreaking, and we're going to fix it. My job, I said right from day one, I'll take ownership of it. I'll take ownership because I'm Premier, and the buck stops with me. And I inherited a broken system that I'm going to fix now, with the help of medical professionals, and we're going to take care of it. And but I also. I always try to look at the glass as half full instead of half empty. Well over 80% of the homes have done an incredible job. The frontline healthcare workers are amazing. They're heroes. The ones, even these infected homes that went in there, they put everything on the line for us and did their best. I always say it starts at management, and 80% of the homes, in excess of 80%, are doing extremely well and being run very well. I'm sure there's some bad actors, but the vast majority of homes are being well run, and the folks are taking care of it.
Next question.
Next question comes from Rob Ferguson from the Toronto Star. Please go ahead.
Hi, Rob.
Oh, hi, Premier. I just wanted to check. Yesterday you were pretty adamant that we would not do reopenings or regional reopenings. At what point yesterday, last night, or this morning did the light bulb go on in your head and say this was okay? What was the turning point?
Well, there's never a light bulb that goes off in my head. I take the advice. It's about a team approach, everyone working together, including what you hear out in the public, what you hear right across the province. And again, if the health table comes back and says there's absolutely no way 100%, I'm no health expert. I rely on health and science. I'm not going to go against the advice of medical professionals in this. And again, the more tests that we're seeing, and the numbers were very, very positive when I saw 18,000, I thought that's great. And you heard the strategy through Matt Anderson and Dr. Heyer and Dr. Allen, extremely bright individuals. And then we have Dr. Williams and his team as well. There's no way I'm going to disagree with the advice of any medical professionals. But we have more testing. We have a better scope on what's happening around the province. That's what allows us to make these decisions. And moving forward, and I've said it from day one, this thing moves so quick. This COVID-19 moves so quick. It's so fluid from day to day to day. You have to be ready to make the changes. And I think the worst thing anyone could do in my position or any position is dig their heels in and not be open to ideas. I've always been open to ideas, and I'm never too shy to say, hey, we're moving on.
Follow up?
Yes, just to follow up on that. When you do regional openings, what are you looking for specifically? Because I know a lot of areas really don't have any or many cases anymore. And what do you do to stop, for example, someone from driving from Toronto, where we have a lot of cases, down to London to get a haircut? How do you stop that? Do you do anything about that?
Yeah, I'm going to pass it over to the professional here, Dr. Williams. And again, Dr. Williams, I want to thank you for everything you're doing. This gentleman has been working around the clock on this, so I'm very grateful for his support and his advice.
Yes, as the Premier said, we're looking at our table of how we would do regional opening on that. And what we've seen in the data lately, and now we have most of the long-term care survey done, we're getting a picture of what's happening live time, and a lot of our cases are focusing in around the GTA. So then some health units, as you've noted, are seeing no cases for now sometimes 2 or 3 weeks in a row, and that's very encouraging. So when we look at regional, we have to look at how would you organize that? What does the difference in regional mean? And how do you interpret that to your public? How do you interpret that to your decision makers? That means your municipal officials, so you can communicate this in a way that the public understand, and as we've done in some other areas, that they would respect each other's jurisdictions and not overcome that and try to violate the regionalization and compromise the process in that. So far we've had a great cooperation from our Ontario citizens, and we would hope to include that if we did a regional variation, and to I guess reinforce the positive value of how Ontarians respect each other and want to contain this virus.
Next question.
Next question comes from Randy Rath from CHCH-TV. Please go ahead.
Hi, Randy.
Hi, Premier. To get back to Rob's question about jurisdictions opening and what we've always been afraid of, people from hotspots like Toronto flooding into those regions, would it not make sense to keep some regions that are an easy drive from Toronto closed, even if they would meet the criteria, simply so that doesn't happen?
You know, Randy, I got to tell you, you always give great questions. You do, but I just want to pass it over to the expert, Dr. Williams, again, if you don't mind. He's driving the system, and he understands it.
So similar to what to Rob's question, if you're going to have that, what kind of definition of region do you work on? When you have two areas right beside each other, if there's quite a difference between what level they're at, that makes it very difficult for the public to understand the rationale, and that's why a number of our medical officer health were looking ahead to say, if you give us a target and we have to go below that, what kind of data can we collect locally to say, why we're not going to go all the way, we're only going this far, but health units next to us or adjacent to us, if they're different, how do we explain that to our public and our decision makers at the local level, why there is a difference, in a way that the public would respect and honor that? And what kind of regions would you define? So at the point you're raising, that just right adjacent, it would be more frustrating and perplexing to the public, but a little bit further out might make more sense. These are all very good questions, and ones we're going to have to look at to understand what the public think of regions and areas that not only are defined, but ones that would make sense as far as the local data is concerned, and they would want to continue to respect that and to continue the downward flattening of the curve here in Ontario.
Follow up?
Okay, so if I can interpret what you just said, we're more likely to see areas, say, in the north and more than a day's drive away from Toronto open sooner than areas that are more centrally located around Toronto. Am I correct?
So again, we'd have to look at that and see where the cases are occurring. One of the aspects we have to be careful of in our regionalization is we want to make sure if there were cases introduced or came back again, if they are further out, and we know very concerned about the north where we have remote communities, especially First Nation communities that we've been very attentive to, working with our counterparts, whether it's the Chiefs of Ontario or with Anishinaabe-Oski Nation or with Slough Lookout First Nation Health Authority and other treaties to say what is the safe precautions there. Some of those ones have still had cases in the last week, so they have not been down to that 0 mark for a number of days in a row. So we want to see that there, and then to look at the cross-border aspects from other places, such as from south of the border, because border crossings, there's only one about an hour from Thunder Bay, and you have Manitoba as well with Kenora. So we have to be attentive to those other aspects, not just in isolation, but to see where those risks can come from, and to be concerned that if it did get into one of those areas, that would be very difficult to contain, and we do not want to take that chance or risk, to be reassured. So it's not just some numbers at one time, it's the wider picture that we have to consider.
Next question.
Next question comes from Lucas Meyer from News Talk 1010. Please go ahead.
Hi, Lucas.
Thank you very much. Just to go back a little bit on what Rob was saying, Premier, one of the reasons you've obviously been resistant is that whole issue that Randy was just talking about and the travel. And you have to look at a lot of factors. Are you concerned that that certain people in certain Ontarians are actually going to be upset by this, in the sense that they're going to see certain areas of the province open and theirs won't, and they're going to have to wait? And does this also mean you're going to open up more on the Service Ontario side, where we've seen issues there?
Well, good question. Again, that's on the table right now, and we're looking at it, a regional approach. But again, it changes all the time. I'm going to give you an example. It wasn't probably more than 2 weeks ago, or a couple of weeks, maybe 2 or 3 weeks ago, that I talked to a lot of mayors up in cottage country saying, no, they don't want people coming up. And I think everyone remembered that. And then about a week and maybe a week after that, week and a half after that, and I remember telling people, bring up your own food. I got a call from half a dozen mayors saying, okay, tell them not to bring up their food because the retailers want people to start buying out of their shops. So it's not their fault. It's very fluid. It moves quickly on this, and I understand. Maybe 1 week they'll say they don't want them, and then a couple of weeks they want them. So we're going to look at everything, and the more testing we do, the better results we can have and measure and look at stage 2.
Follow up.
So thanks. And so I guess, Premier, so you're not particularly concerned about alienating certain parts of the province, and perhaps a question for the minister. You mentioned yesterday that we're at least a week away until considering phase 2. How does this decision now potentially affect the timeline of when phase 2 might begin for certain areas?
I'll pass that over to the minister. Thank you.
Well, we developed a plan very early on for 3 stages of openings. That's something that's very important from a public health perspective, because we need to see the effects on public health with each stage. So we are just now starting to see cases that are probably resulting from the gradual reopening of our economy in stage 1. That needs to be thoroughly examined so we can then decide at what time we should open up to stage 2 and under what circumstances. The regionalization is a separate issue, but the timing of the stages won't be. That's going to be based on the number of new cases, the hospital capacity, the contact tracing, and all of those things have to come together for the public health table to make a decision that they feel that it's safe, and make that recommendation to us as government that it's time to move forward. So we need to be very cautious and measured about this. I know that people are anxious to get back to business, but public health has to be the number one concern, and the health and safety of all Ontarians is our primary concern and always will be.
Last question.
Last question comes from Colin DeMello from CTV News. Please go ahead.
Hi there. Good afternoon, Premier. I just wanted to ask a question about long-term care. So you say that the federal government needs to help the province with the cost of overhauling long-term care. I'm just wondering if you have a dollar figure attached just now. How much money are you looking for from the federal government for an overhaul of the system?
Well, yesterday in the conversation with the Prime Minister and the other premiers, he understands how serious the situation is in a couple of the provinces, and it affects everyone, and he's committed to make sure he's there to help the most vulnerable and protect them. To give you an exact dollar figure, I don't have that, but we'll have that as we move forward, and make sure that we have the support of the federal government. And again, I'm grateful for their support and the comments the Prime Minister has said yesterday on our call.
Thank you, Premier. And I understand that the province obviously has its fiscal restraints, as you said in the past. But I'm wondering, why isn't Ontario willing to bankroll the entire cost of overhauling the long-term care sector in our province? And don't our seniors deserve that type of investment from the province that they've spent an entire lifetime working to support?
Well, first of all, they deserve it. They're the ones who helped build Ontario, helped build Canada. If there's anyone who deserves it, they deserve it. Financially, we just need the support. We don't have the printing press that the federal government has, and I'll spend every penny we have to make sure the people are taken care of, the most vulnerable are taken care of, and we're getting to that point. But I just appreciate the support the federal government is offering. So we're going to take them up on that offer, and you'll be the first to know, and the people will be the first to know how we're going to spend that money on long-term care and come up with a strong strategy. As I said yesterday, we have to the immediate issue, the issue moving forward for 3-4 months. God forbid we ever get hit with a second wave, and then a long-term strategy. And everyone needs to be involved. The frontline healthcare workers need to be involved. Even the owners of these long-term care homes need to be involved. Everyone needs to be involved to come up with the right solution. But
Thank you, everyone.
Thank you, everyone, and have a very safe weekend. And don't forget, go get tested. Thank you.